Okay, so my patient's name is Amy. She's a 16-year-old female. She reports developing right lower extremity and back pain 2 days after sustaining a right ankle sprain playing soccer about a month ago. She's examined by our PCP, and upon examination, she had decreased skin temperature and was cyanotic near the site of injury, along with swelling and some allodynia. Her PCP ordered blood tests and imaging, in which both came back unremarkable and within normal limits. Currently, the patient is experiencing symptoms that are not consistent with her initial injury, and she's also been experiencing some fluttering in her chest and symptoms that just don't seem to fit a normal pattern of injury. Amy's very active in school and has a family restaurant that she feels obligated to help with. Currently, she's not able to do so. And she also lives with 3 other siblings, which also provides some challenges because one of her sisters she's actually has a room with, and at 16 years old, that could possibly provide some kind of challenge. And based on her unusual symptom patterns and some of the contextual factors in her life, I believe she may be experiencing complex regional pain syndrome. So complex regional pain syndrome, it's a chronic neuropathic pain disorder, and it's usually distinguished by significant autonomic features. With her, this is going to be pretty key because she's having cyanosis near the site of injury along with the decreased skin temperature, which is usually consistent with that syndrome. She's also experiencing the allodynia, some hyperalgia, and some burning pain, which she indicated in her McGill pain questionnaire. Along with the trophic changes, she's also showing some signs of anxiety, which may also be part of that autonomic response that she's having. And also that's going to be greatly influenced too with all the social things that she's missing out on at school and all the things that she needs to get back to doing. The main thing also is just her symptoms with the ankle sprain just are not consistent with what we would normally see with that injury. And what we're seeing is just a lot of global pain on that right lower extremity that doesn't necessarily correlate with an ankle sprain. As far as the medication she's taking right now, all she's taken is the budesonide and the Symbicort, and that's because she has asthma. The only thing really note with that is that that's definitely something she needs to have with her while we're doing therapy. And she also was prescribed acetaminophen and naproxen, but she's not taking it right now, which I would encourage because we don't want to try to feed into that ideation of pain, so trying to avoid that, and also some of the GI problems that could come with naproxen as well. Some of her risk factors right now, just need to know that she's allergic to latex, so try to stay away from gloves. She does have asthma, and she's also having some chronic migraines along with some of her symptoms, so maybe trying to avoid a well-lit room or anything that could influence those symptoms to exacerbate. And she also is having some signs of anxiety and depression, so definitely want to keep an eye on that and try to provide maybe some questionnaires, see where she's at, and make referrals if needed. So as far as her labs and the imaging was concerned, all labs appear to be within normal limits, and the imaging shows to be unremarkable, so that kind of also is a good indicator as to what may be going on with the syndrome she's experiencing. Her heart rate and her blood pressure were they weren't completely out of a normal range, but the blood pressure was low and the heart rate was up. So maybe there may be some white coat syndrome going on there, but we may just need to monitor that as we go along with therapy. Some of the yellow flags was the decreased temperature on the right ankle along with the cyanosis, so definitely want to check for any arterial compromise that may be contributing to that. And also some of the fear and anxiety and possibly just some of the depression that may be going on due to all the other things such as her contextual factors. She's a junior in high school. She's extremely busy, social life. She's involved in bands, soccer, and the National Honor Society. And she's also trying to help her mom and dad with the restaurant right now. She's unable to do that. So she may be feeling kind of like a burden to her family right now and not being able to help and participate with her teammates and schoolmates. And she's also getting ready to drive, and take a test, and with all the pain she's having in her right leg, that's definitely going to bring up some complications there as well. So going into body systems, I definitely first thing I want to check is cardiovascular, like I stated earlier. Just checking for any venous or arterial insufficiency that may be occurring. So checking pulses and doing any other tests that we feel may be indicated to rule out cardiovascular compromise. Second, going into musculoskeletal system, obviously she had the ankle sprain, so we definitely want to check that and see where we're at with healing as far as we can anyway. And definitely assessing just everything from lumbar down on both extremities, just trying to compare and see if there's anything that we need to address before we move on to anything else. From there, we'll go into neurological, just checking some of the burning sensations and things she's having that's going down the leg. Definitely want to be checking light touch, looking at reflexes if possible, and myotomes and dermatomes, just to make sure there's no neurological compromise as well. And then after we can roll all that out, we'll go into psychological. So just trying to see maybe as far as where she is with depression, anxiety, just her mental state overall. So maybe giving her a fear avoidance belief questionnaire or something like that along those lines to kind of see where we're at, and just trying to build that rapport with her so that we can start treatment. As far as treatment goes, I would like to start just by trying to desensitize the area. Right now she's very hypersensitive and having allodynia, so we want to try to address that through soft tissue massage or anything that we can that she could tolerate at this point. Just try to get everything calmed down, and then from there we'll start education. Definitely educate her on the chronic process that she's going to be going through and how what is exactly happening that may be causing all this to flare up like it is. Just explaining the psychological side of this syndrome and trying to get her to get on the same path with me as far as understanding what's exactly happening. From there, we can go ahead and start planning how we're going to manage her pain, and then start trying to get her scheduled and see how we can, how many times we can get her in and what kind of homework we can send home with her. I believe Amy has a really good prognosis to return to doing her normal school activities and playing in soccer and being able to drive and all the things that she's missing out on right now, because she's young, she's very active, she's smart, she's in the National Honor Society, and that's going to go a long way with the healing process and understanding how we're going to get her back to a normal level of function. I know that we're going to have to address her, that it's going to take some time and commitment, but I'm certain that we can overcome this together and probably work towards getting you back to normal. And it's going to take a lot of courage on her part, and there's obviously going to be some rough areas along the way, but with dedication and determination in and outside of therapy, I'm pretty positive that she will be successful.